Bella Salon and Day Spa, located at 41 West Main Street in Northeast Pennsylvania, proudly supports Chautauqua Sunrise and its volunteers. More information at bellasalonanddayspa.net. Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Funding is provided by a grant from New York State Senator Catherine M. Young, representing Western New York's 57th District with a local office in Olean. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. From the Access Channel 5 studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Channel 5. Continuing the traditions of Senior Report, we are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week, countywide, from 9 to 10 a.m. Join us by calling in live, emailing us, or checking out our social media. And now, from the Channel 5 studios, it's Chautauqua Sunrise.
Hey, good morning, everybody. Happy Saturday. I'm Doc Hamels, and you're watching Chautauqua Sunrise here on Access 5. Finally, sunshine. I think we've had just about a full week of sunshine. I don't know about you, but it really energizes my batteries and as well as my solar lights outside. The other night I walked through the living room in the dark, and all of a sudden it was like I thought I had spaceships landing in my backyard. It was just my solar lights. They haven't been charged up forever, it seems. So anyways, the weather finally is getting there, and I think we're going to be in the 40s pretty much this coming week, so that's going to melt most of the snow that's left, I hope. I don't know about your house, but somewhere along the line we had this snow, then we had ice, then we had snow on top of that, and just built up on our eaves. And I got some icicles that look like something that you see on the moon or someplace. I mean, they're just extended out over the roof line about 2.5 feet. I don't even know what's keeping them there. And then, of course, every once in a while you hear this thunderish bang, and it's something that slid off the roof and landed on one of your rose bushes or something. And we still got quite a bit of that ice left to go, so I'm hoping this week that they disappear. It'd be safer that way. Poor old Max, I have to keep an eye on him. Max is my dog. I don't want him going under that ice. Okay, so it looks like we're definitely into the spring. All the signs are there. The robins are flocking back. The deer are on the move. We already talked about skunks. Skunks are in Ripley, it's the first sign. You smell skunk, it's spring. We're done. And now it's officially on the calendar. So I'm hoping that you're getting ready to think about some nice weather and some getting outdoors and get walking and moving and bike riding. We're getting ready for the ride for Roswell. A bunch of us here at the studio, we're going to talk about that more as we get closer, but we got to get our bikes out. I don't know. I look at the bike and I think, oh boy, I wonder how long it's going to take to get in shape again, but we'll get there. Okay, I also want to say good afternoon to our friends at WRFA 107.9, low power to the people in Jamestown. Thanks for dropping by and listening in. We're broadcast Tuesdays at 1 o'clock, so if you don't want to catch us right now, you can re-catch us later. So anyways, glad to be on, and hope you're having a good afternoon over in Jamestown. Okay, A couple things coming up this week. Just want to give a shout out to my friends over at LSS. Will and I are going to be playing there Monday at 6 o'clock in the library. We're going to do our final St. Patrick's Day Irish Celtic program. We did 5 of them last week, and I'm happy to report the dye came out of my beard. I had a green beard on the studio. That kind of shocked everybody. But anyways, it came out. Barb kept saying, it's not out yet. And I go, it's supposed to be one rinse. It's supposed to come out. Well, I kind of had this minty, fresh look on me. Anyways, but 6 o'clock LSS, and then a brand new venue we've never played up in Brockton. We're going to be at the Nickel Plate Depot next Friday from 8 to 11. So drop by. I always like to let you know where we're going to be. Okay, I got a bunch of, oh, what is this? Someone here at the studio is going to have a birthday. Who could that be? Is it your big brother? Yes, it is. Justin, it's your big brother, Chris. Happy birthday, Chris, on the 27th. He's going to be 27 years old on the 27th. So Chris is kind of like our director here at the studio. You never hardly ever see him except on our last show of the season when I bring the crew on. But Chris does a lot of work behind the scenes for us, and as well as putting together all of the announcements. So happy birthday, Chris, and many, many more. All right, let's do our community announcements, and then we're going to get to see and talk with our guests that are patiently waiting in the sidelines. Emerald, you got their makeup done yet? Okay, almost done. Okay. Let's start out in Jamestown. The Infinity Visual and Performing Arts welcomes new instructors. I guess we have some slides, Jeff. There they are. Okay, so the first one, that'll be on my left, you're right. Britt Anderson, traditional art, drawing, and digital art is her area. She's an artist with a passion for character design and animation with an unquenchable, wait a minute, let me try that one again. Unquenchable thirst for vintage styles. Britt is a strong advocate for arts education in schools and is beyond excited to share her knowledge and experiences with the team and students at Infinity. And then, someone after my own heart, Corey Watson. His main thing is guitar. Looks like Stratocaster. Okay, he's a proud local who has been part of the music scene since the age of 15, spanning from Buffalo to Erie. He started learning to play guitar at the age of 9. Corey prides himself on his fun, caring, thoughtful personality and is a strong believer that with enough determination and perseverance, you can achieve a lot more than you think. So welcome to those instructors, and if you haven't checked out Infinity, it's an awesome organization for young folks to learn theater, music, arts, drama, just all kinds of the fine arts. It's just great. Graphic arts. Okay, they also want you to know that they're hosting a music and arts day camp from Tuesday, April 3rd to Friday, April 6th. Students will experience a variety of art, music, film, and theater activities. Make cool art, script, and film a movie, join a band, explore instruments, all in 4 fun-filled days. It's going to run from 9 a.m. to 4 p.m. daily. Students ages 6 to 12 are welcome. What a nice Easter break that would be, to hang out in Infinity and get all that stuff in. I would have loved it when I was a kid. Reminder, Northern Chautauqua Community Foundation has tons of grants and scholarships available. We're getting to that point in time where young folks are starting to apply for colleges and various things. So check them out on their website at nccfoundation.org. Okay, NCC Foundation, all one word, .org. Check them out, and you'll find that they've got lots of things available that you wouldn't realize that are out there. And there's special scholarships, and maybe your son or daughter or niece or nephew, grandchild would be eligible for that. Also, I like to remind small agencies, communities, towns, villages, whatever, they have money available for special projects for your communities as well. And so they have their grants program, and we announce some of them from time to time. Okay, this is the last call on this one. Okay, this is from the foundation. Right now, as we speak, is the 6th annual Applebee's Flapjack Breakfast and Basket Raffle. All right, I'm not going to go into great detail. All I can tell you is it started about an hour ago, and it's going on right now at Applebee's out on Vineyard Drive in Dunkirk. So watch my show for another little bit, and then get in the car and go over there and get some pancakes. They have baskets, and they have Chinese auction, and they're giving away all kinds of cool prizes. And if you want something to do right away this morning, I want some breakfast, support a great cause, Applebee's in Dunkirk. Okay, they also want you to know that the Reverend Clifford Cliver and Lucy Cliver Sumsky Scholarship is available. Established in 2015, Reverend Cliver designed this scholarship to assist students over the age of 21 who have been in foster care. The scholarship is awarded annually without regard to the student's financial circumstances. Aside from age and being in foster care during any period in their youth, students must currently be attending or have been accepted at a university, college, or trade school, and a graduate from a school district within Chautauqua County. Okay, and of course, more information, give them a call at 366-3905, and the deadline on that is July 1. We announce various scholarships from time to time, and that's an interesting one. You never know. Okay, today, 2 p.m. in Gary, at the Gary Rodeo Dining Hall. Compeer is having Canvas for Compeer, and they're doing one of those, you get a blank palette or whatever you call those things, and you sit there, no, the palette where you have your paint, what do you call that thing? I don't know. You get a board, and they lead you through the steps of some artwork, and I know a lot of folks have done this. My wife has done this over the years. So it's going to be held at 2 p.m. It's at the Gary Rodeo Dining Hall, $30, covers materials, goodie bag, coffee, hot cocoa, water, and snack bar. If you're interested, give them a call at 487-2956. Last call on that one. Jeff Smith from St. Susan's was on not too long ago talking about their 15th annual basket fair. And he was good enough to send me the update of what happened. You know, we talk about these announcements all the time. Did you win anything?
My uncle did.
What did he win?
Harley Davidson stuff.
Oh, very nice. Harley Davidson stuff. Okay, so they had what was like over 120 baskets. Oh, 148. There's the update. Okay, so here we go. Irish eyes were smiling for the 15th annual St. Susan Center Basket Fair, which was held St. Patrick's Day, the 17th, at the JCC Physical Education Complex. There was a sea of green, not only because it was St. Patrick's Day, but also the green iconic St. Susan t-shirts were worn by staff, board members, volunteers, and so on. The fair was attended. I don't write this stuff. You never know what you're going to get here. The fair was attended by 738 people, an increase from 601 last year, all trying the luck of the Irish to win one of the 148 prizes and 3 grand prizes. And the attendees were entertained by Nick Myers, a primetime DJ who also doubled as the prize announcer at St. Susan. Okay, and then lunch was provided, as we know, and they brought in over $25,000 for the center. So congratulations, and remember, last year the soup kitchen served 121,547 meals. So this is not a small deal. That $25,000 is going to go a long ways to help a lot of people that need to eat. All right. Still in Jamestown, Rolling Hills Radio. My buddy Ken Hardley wants you to know that at Shawbucks, coming up on the 26th, which is a couple days from now, they're going to have a new production with Goodhue and Vandenberg, plus the Urban Pioneers. All right, and we've talked about them from time to time. They're going to be performing at 6:30. There's a happy hour at 5:30. Tickets are $15. If you want to attend, it's 484-1101. And you can go to the Chamber of Commerce, chautauquachamber.org, and get tickets that way. I went to see Tom Paxson. It's a great venue. It's lots of fun. It's well done, very professional. And if you want an evening of music and fun, check him out at this coming Monday. Okay. Melanie Wachowski was just here recently, and we were talking about some of the projects they do at CASIC. And this is substance use and breastfeeding, okay? Wednesday, March 28th, from 10 a.m. to 1 p.m., lunch will be provided. It's a workshop regarding this, and it's going to be at the UPMC Chautauqua WCA Auditorium. For registration, give them a call at 708-63 888-888-9999 and ask for Catherine Harrison. Okay? Opioids, as we know, and substance abuse, alcohol, and so on, it's been a big issue, and you can well imagine we don't want to be passing that on to our newborns. All right. Here's a did you know. The 4th annual American Red Cross Giving Day is on Wednesday, coming up March 28th. Giving Day takes place in March during Red Cross Month, a time to recognize heroes who help those in need in their community all year round. Giving Day is an opportunity for local communities to come together on one day to help the families who have been impacted by a home fire or other disaster and who urgently need Red Cross services to get back on their feet. For more information on this Giving Day, give them a call at 1-800-RED-CROSS or go to redcross.org. Okay, let me just see if I've covered everything here. And last one. Okay, we've been talking about this a little bit right along since we were notified on this. The Rusty Bova show. It's going to be a concert at the Lakeshore Center for the Arts right downtown Westfield at the Presbyterian Church. He's an international jazz clarinetist and saxophonist, and it will be held at the William Bill Ross Recital Hall, and that's going to be at 7:30 on April 14th. And just to let you know, Rusty will be my guest. I believe it's April 4th, so we're going to learn all about what he's going to be doing, and he tells me he's going to give us a little sample of his music. Okay, and that's it for community announcements. I'm going to turn it over to our crew to give us a public service announcement. Stay tuned. We'll be right back.
This is the moment I knew. His future had no boundaries.
There are some moments only the forest can inspire. Find yours at discovertheforest.org.
And I'm back. Well, folks, one of the things I like to do here at Chautauqua Sunrise is interview people, as you well know. And sometimes they're people I know, and sometimes they're people I don't know. And sometimes I know people, but I don't know what the topic is so much. Long story short, I ran across this particular program, and I thought to myself, why don't I know anything about this? This is hard to believe, because I thought I knew most of the major things going on in Chautauqua County. Well, my friend Rebecca Ruiz, for some reason I caught the fact that she was involved with this agency because I knew her from a different agency, and I looked it up and I said, wow, we need to talk about this. Well, I want to welcome Rebecca and Alicia Ekstrom, and you are involved with the Chautauqua Center.
Yes, ma'am.
Yes.
I hardly know anything about this, and I'm totally excited to learn more about it. And one of the things, it was just in the newspaper just recently, that Chautauqua County is not exactly the healthiest county in New York State. I think we're like, I don't know, like 25 out of 30 or 25 out of 28, or not a good place to be. So, as you know, I'm involved with the Westfield Memorial Hospital Board of Directors, and I'm kind of immersed in some of the issues that we're dealing with here in Chautauqua County. So I have a keen interest in what you're about, and so we're going to find out more about that. But before we do that, let's find out a little bit about you. So who wants to go first?
I'll go first. Well, what do you want to know?
Okay, so Alicia, tell us a little bit about where you went to school, where you're raised, how you got to be involved with the Chautauqua Center, and so on. Because you have a cool title. You're called Recruiter and Marketing Specialist. That's really cool. They kind of go together. Yeah, so tell us about all that stuff.
So I have been with the Chautauqua Center 3 years now,
Okay.
coming up in August, which is so hard to believe because it really has flown. I moved to the Chautauqua area from Buffalo.
You're from Buffalo?
I am,
Where in Buffalo?
yes. Lakeview, Hamburg area.
Oh, South Towns.
Yes, the South Towns, yes, by the lake.
Because I'm from Buffalo. I was up in Buffalo, like near the zoo Buffalo.
Oh, yes.
Diehard, Dino,
Northbound.
yeah. Okay.
So I went to school at TUville. I graduated with a health service management degree, and I was hired as office manager. I worked as the office manager for the Chautauqua Center for 2 years, and then just this past year I transitioned into the recruiting and marketing role. And
Okay.
it has been it's been Fun.
Fun. Well,
Very fun.
and that's great. And the whole time you've been here, both of you have been just smiling. So, I mean, it must be something you're happy to talk about.
Yes.
So what does a recruiter do at the Chautauqua Center? I mean, what are you recruiting for?
I just recruit.
Just recruit.
I
Pull people
recruit-
strangers off the street.
I recruit physicians, dentists, general dentists, hygienists, dental hygienists, dental assistants. I recruit pretty much all
Social workers.
positions, social workers. I recruit patient specialists. I recruit anyone that is pretty much employed at the Chautauqua Center. So
Knowing what I know, you've got an impossible job.
it,
How about I say, how about this? Urologist,
no,
dermatologist.
no.
Right? They don't exist. We need them, but they don't exist.
Yes,
Okay.
yeah.
All right, we'll get back to you in a minute. How's that? Okay, Rebecca Ruiz. I knew you from another agency. Now you're over here. So I was like,
Yeah.
when did this all happen?
So I'm Rebecca Ruiz. I am the Chief Operations Officer at the Chautauqua Center.
You're the COO.
COO.
I think you're the first official person I know that can say that you're a COO. I know CFOs, I know CEOs, I know CSOs,
COOs.
COO.
So I started with the Chautauqua Center almost 5 years ago. It was my first time ever being laid off from a previous job.
Not a good feeling.
No, not a good feeling. And our current CEO found out that I was no longer employed, and so he said, "Hey, why don't you come work for me?" I started off as the outreach coordinator. So my job was what Alicia is doing now, as well as bringing patients into our centers, letting the community know about the center. And then about a year ago is when I was promoted to COO, and now I oversee 4 offices. So
You have 4 offices, and I don't know anything about this place.
So
You guys ever heard of the Chautauqua Center? Nobody knows you. So my job is cut out here. I'm ready to make the world know who you are. And remember, folks, this is going to go on YouTube. So once it's on YouTube, everybody's going to know about this. All right.
So the Chautauqua Center, the history a little bit about the Chautauqua
Please.
Center, is you have to, in order for an area to have a federal health center, there are 3 things that you really need to prove. The need, obviously, we have a need. We have a high poverty rate still here in Chautauqua County. We still have a high, at the time, we had a very high rate of people who were uninsured, which also brings a federal health center to an area. And as everyone knows, the shortage in doctors and psychiatrists and dentists and social workers is another reason. A lot of them don't want to come to rural areas, and as you know, Chautauqua County is very rural. So we had agencies who worked together to apply for this grant. And
How long ago?
they applied for the grant in 2012.
So this is relatively a new
It is
thing.
relatively-
Oh, maybe that's why I don't
yes,
know.
yes.
Okay, 2012.
So we opened our doors in January of 2013 in Dunkirk, is where the first location is.
Okay.
We are open, we decided to have evening hours, so we try to cater to everyone who works as well. So we're open 8 to 7, Monday through Thursday, 8 to 5 on Fridays. We were there for approximately 2 years. That's when we opened our second site in Jamestown.
You're in Jamestown?
Yes, September of 2015. And then in Jamestown, we had all programs in one. So we had the primary care, the dental, and the behavioral health. So we have social workers, psychiatrists, nurse practitioner, psychiatric nurse practitioner. So we started with all the programs there. In December of 2016 is when we opened our dental office in Dunkirk. So we now have dental in Dunkirk that we offer to the community. In this past December of 2017, we actually took over a pediatric office in Dunkirk, Dr. Parik's office. Now it is the Chautauqua Center, and we have Dr. Parik there, as well as Dr. Sabapathy. So, and we are in the middle right now of building a 2-story facility in Jamestown.
To do what?
So, to put all of our services under one roof.
Oh, okay, so your main hub there.
Yeah, it'll be the main hub, yep.
Where's that going to be?
That will be where the old Artone building used to be on Institute. So we're in the medical corridor, which is really nice.
Okay. This is overwhelming already.
lot to take
I mean, really, like I said, I'm going from 0 to 100 here in a second. The first thing that comes to my mind is redundancy. Why are you doing this? I mean, there's hospitals and there's somebody in my ear said, what about the resource center? I mean, how does this all work? I mean, is there enough for everybody here?
Oh, yes, there's definitely enough. As when I first started, we had 40 patients, and we are probably close to 7,000 patients in the past.
7,000 patients?
Yes, unique patients in the past 5 years.
Over 5 years?
Over 5 years,
Okay,
yes.
so how many a year then? Like 1,000?
It's probably around 1,300 a year.
Holy moly.
Yeah,
All
grew
right.
very quickly, so
All right.
there's a need.
All right, hold on a second. I got to do something. Okay, folks, you are watching Chautauqua Sunrise. We're learning about the Chautauqua Center, and if you have a question for my guest, give us a call at 753-5225. Obviously, I don't know anything about this. You may want to know more, and I may not be asking your question. Well, let's continue. All right, so this must be filling in a gap somewhere.
Well, definitely is filling in a gap.
All right, so help me now. We got WCA, we got Westfield, and we got Brooks. And Willow Shore. How does this? What are they missing?
Well, we're a primary care, so we're a doctor's office is really what we are.
Oh,
That's what we are. It's a primary care, so
All right, doctor's office.
we're a family practice. Yes. So there is a need, and as mentioned previously, you have to prove there is a need in order because we're a federal health center, so you have to prove that there's a need in the area, and those three huge are the poverty, the high rate of uninsured, and of course, we are deprived of doctors and psychiatrists. So
Okay.
risk.
So where is the closest other federal health center?
there are 4 sites in Buffalo,
Buffalo.
and then the next there are 2. Well, there's one major one in Olean, but they have sites in Salamanca. They have a site in Cuba, and they have a site in Houghton, at Houghton.
Okay.
So, yeah.
Hold me back
It's
for a
an
second now. Wait a minute. So those aren't close whatsoever, obviously, especially for folks that don't have the means to get to wherever. You're a primary healthcare office, like a doctor's office, you said. What were people doing before that?
Well, they were being overwhelmed. They were overwhelming the other doctors' offices. So, the fact of the matter is we have a lot of area doctors who no longer accept Medicaid. So it was very hard for patients to find quality doctors that, care about them. And so, that is also what brings us.
And we've talked about this on the show before, is, especially younger folks, they, we've all been there. We think we're invincible. We think we don't need doctors. And as time goes by, we keep that thought in our brain, and meanwhile our health is deteriorating, whether it's dental, whether it's whatever. And by the time they get to the doctor's office, now it's expensive, or they can't go, and so then they end up can't work. You know what I mean? It's like a drain. And had they gotten the services earlier, we'd have a healthier community. And like I said, I think it was even in yesterday's paper, there was an editorial in the Post-Journal about, the fact that smoking and obesity are a huge problem in this county.
Yeah, huge.
All right. So you're a federal health center. New term. I've never heard that before. All right. So then do you refer to hospitals?
Oh, yes, absolutely. We have great relationships with our local hospitals. We refer back and forth, and we have to have agreements in place. Being part of a federal health center, there's a lot of requirements that you have to meet. So we have to make sure that our patients, the unique thing about the Federal Health Center is we look at our patients holistically. So it's not only are we working together on their health care, but we also have to think about their mental well-being as well as their dental, because it all fits into one. If you're not doing well at home, we want to make sure that whatever is happening at home is not affecting your health. So we have the counselors and psychiatrists, and we also do a little bit in substance abuse as well. So, so as I mentioned, it's holistic.
We try to touch on all areas of health.
The whole person, right?
The whole person.
Yes.
Okay, so I'm going to go to Alicia now. So, I don't know. Let's make up somebody that doesn't have a doctor. All right, let's say they moved into the area. They're brand new, and they may not have the best insurance in the world, because we know that there's been some real issues in the insurance world. So if they hear about this, how do they start with you? I mean, do you have to get a referral? I mean, do they just walk in? How does it work?
Yep, walk-ins, phone calls. We have a call center that takes phone calls all day from Dunkirk and Jamestown, and we see individuals that were referred from family, friends that even are employed there. Anyone can come to us, which makes us unique. That's what really federally qualified healthcare centers are unique in of itself, just because we do accept anyone, no matter what your income is, no matter what your insurance type is, which is pretty unheard of now, especially with physicians, that they'll accept certain insurance types. But we accept all. We're a one-stop shop, really.
Okay, so let's backtrack a little bit. If they want to call, what's the number?
716-363.
Yeah.
6050 is our Dunkirk location.
Okay.
And then Jamestown is 716-484-4334.
And then, go ahead.
We actually also have a pediatric phone number.
Okay.
716-366.
6036.
6036?
Yes.
See, it's not easy doing the show, is it?
Well, and that's our newest site, so I'm really trying to.
Okay, so that's for the pediatrics. All right.
Yeah.
So all right. So for those of you out there right now listening that don't have a doctor, and they have some insurance that doctors won't take, they call this number. I'm trying to go step by step here. All right. So and so they have to. You can just walk in or book an appointment.
Yep,
How's that
they
work?
can walk in and or call. And we can schedule either the appointment over the phone. It takes about 20 to 25 minutes. Being that we are federally qualified, we do have certain criteria and questions that we do have to ask.
Like what?
Gender, sexual orientation, income level.
Okay, so the general stuff.
Yes.
All right, so I'm on the phone and you say, come on in to the Dunkirk site. Where is it? You haven't told me that.
So Dunkirk, our primary care is at 319 Central Avenue.
Oh, I know. I generally know where that is.
Right before the boardwalk, yep.
Okay.
And then we have our dental site, which is across the street, directly across the street at 314 Central Avenue.
Well, that's convenient.
Yes.
Okay. And the pediatrics?
And the pediatric office is at
1134.
1134 Central Avenue.
I see a little commonality here. And the Jamestown, don't tell me it's on Central Avenue.
No, it's not on Central Avenue. 110 East 4th Street is our temporary location.
Okay. To be announced at a later date when you have your new building up. All right. So they say, I don't have any insurance. What do you do then?
So we have certified assisters such as myself and Rebecca and a couple others in Dunkirk and Jamestown that help assist with insurance, set them up through the marketplace, the New York State marketplace. So what will happen is if someone comes through our doors and they say that they need to see a physician immediately, we don't turn away any patients. What we'll do is we'll ask them for, we set them up with a sliding fee scale. So I know this may be a new term for some people. And that's another reason why we're unique in the sense that because we're federally qualified, we have that option of offering that to our patients. So what they do is they fill out, we have an application. It's a couple of questions, not too long. And they'll note their annual income and the number of people that are in their families. And then what happens is that goes through our billing department, and the individual is set up based on their annual income and the number of individuals, and they'll receive a discount from that criteria that they forward.
Okay.
So if they are just coming in to see the physician for the first time because they moved to the area, then and they don't have insurance, one of our certified assisters will set up an appointment either that day or the following day.
Are you saying a sister?
A sister.
I thought you said like a sister.
Oh, no. ASSISTOS.
I'm learning new terms here. A sister.
Certified assisters.
Like an assistant with a A sister. Okay. I just want to make sure I heard that right. I didn't know that you were dealing with the nuns or not. A little Catholic joke. Okay. So, but you have people that are knowledgeable, and so how do they get trained? I mean, obviously you had to go to workshops. I mean, this is pretty intense stuff.
Yeah. Yep, we went to some trainings. I went to one in Buffalo, and then there's online trainings too.
Okay. All right. It used to be called Obamacare and all that. Where I don't even know where it is anymore. Is there still Obamacare? I mean, where are we? You don't hear about that anymore. When's the last time you heard about somebody bashing Obamacare? I mean, I know that's not the name of it, but is it still in effect? And are people still dealing with it?
Right.
Yes, the marketplace is the Affordable Care Act, is part of the Affordable
Right.
Care Act, so as people term it, the Obamacare. So that's where the certified application counselors that she was referring to,
The
that
assistants.
that assist with insurance
Yeah,
is on the marketplace.
I can do this.
Yeah. So that is through the Affordable Care Act. So,
Okay.
and I don't believe they've changed that term, or might be the health care something.
Right. But it's basically the same thing.
It's the same
All right. What happens if somebody has like no money? I mean, they're like just broke. I mean, they still get help somehow?
Yep, we still see them.
Okay. Through the Good Samaritan Act or?
Well, as she mentioned earlier, federal health centers are not really, you can't turn people away. So whether we're setting up an appointment for them to come back, but we have had that, and we continue to have people who come in who have absolutely no insurance and no money. So the first thing we do is get them health insurance, and so that way, if there's something going on with them, at least they're covered. If we have to send them for any kind of specialist, they're covered. If not, because we do have people who say, I don't want to apply for insurance, so they're on our sliding fee. So they would apply for the sliding fee, and then work with our billing company, our billing department to work on a billing statement,
Gotcha.
a monthly billing statement. So.
Okay. Who pays for this federal health care center? I mean, where does the funding come from?
It comes from HRSA, which is the Health Resource. Oh my goodness, I just went blank.
Okay. It's a
Anyway,
federal
federal agency. Yes. The nice thing is that since its onset over 50 years ago, we have support in all parties. So Democrats are very supportive, and
Plus,
Republicans.
right.
Yep, they
get it.
They get it. They know it's a need in the United States. There are probably close to 1,600 health centers per se, just more, we can, by name, across the United States. But in New York State alone, there are probably 600
600 federal health centers in New York State?
who serve close to 2.1 million people across New York State. It's a need.
I'm in shock. I'm so glad we're talking about this today because this is really important stuff. Okay, so if I'm a physician, wherever, am I feeling competition from you?
I don't think so.
A different population, maybe.
Well, we serve everybody, so it's not. We're at a 50-50, so it's 50 Medicaid and 50 private. So there's a mixed balance of who comes through our doors. Really, right now, we have a lot of doctors in the area who are retiring.
That's
so,
true.
So there's a need. No matter what, there's a need. So they're really, do we have some agencies who are not too happy about us being in the community? Right. They view us as competition. But there's so much to go around. There are so many patients who are in need in this area. There really shouldn't be any
If
issues.
I'm hearing you right, it sounds to me there's been a population of unserved right along that never even got to a doctor, and now perhaps they can. Do I get that right?
Yes.
Okay, so let's go back to the recruiting side as far as doctors are retiring, nurses are retiring. So what do? You're trying to get these people to work for
You have to be creative with it. Honestly, it's not as easy as saying, okay, well, I'm going to go recruit a doctor or a dentist or a social worker.
I think it's an impossible job myself, just knowing what I know. I mean, it's not. I mean, how do you talk to somebody that wants to go like big city and make lots and lots of money?
Well, and that's
I'm not saying that you're not paying lots and lots of money, but I'm going to guess it's not lots and lots of money compared to a big city. I'm just guessing.
So what I've done is one of the perks with the federally qualified healthcare centers is that we offer a loan repayment program.
Oh,
Through
to the heart of the matter.
Through our funders,
yes. That's huge.
It is.
Well, let's talk about that a little bit, because I think that's a fair area to discuss. Doctors, when they're in medical school, incur hundreds of thousands of dollars in loans.
Yes.
And they spend the rest of their careers working and paying that back over like 20 years or something like that. So what does this do for them?
So what they can do is they can serve a 2-year commitment and get a significant amount paid off of their student loans, up to about $65,000. And then if they want to commit to another year, they can have an additional $25,000. So coming from a private school, I'm always like, oh yes, you have to take this.
So if, let's just say they work for 3 years for you. I mean, you're talking about $85,000. Just knowing what I know, that's probably close to close to half of what their loans could be. We got a phone call. You want to take a phone call? I don't know who it is. Okay. Good morning, caller.
Hey, good morning. Great show here.
Of course.
A couple of real quick questions. You might have answered some of them, but your prices now, are they like other doctors or like dentists in the area? Are they lower? One problem we've found with dentists is nobody will take new patients even though you have insurance that they accept. That's one thing. And the second question was, when you help somebody that don't have insurance get insurance, is it like social services, or is it another way to do it?
So with the prices for dentists, I think that's what he's mentioned.
Right.
Yes.
We have options. We provide options for you. So we have our sliding fee scale. As mentioned, that it goes by your annual income and the number of people that are in your family, that you receive a discount rate, and it goes along that fee schedule that we have. We also have Care Credit, which is like a credit card, and it helps individuals that that can't afford dental procedures or services.
How does that work?
So there is an application that you fill out. You can fill it out online, or we have some applications right at the front desk. And what they do is they forward that information, and then you pick which, I guess, credit card you really,
So you walk in and say, I'd like to, if it's $100, here's my credit card, and I'll pay off the credit card? Is that
correct? Yep.
Oh, I've never heard of that before.
Yes.
Okay.
Yes.
Okay.
So we have options for individuals, and our mission is we don't turn anyone away. So it's
Caller, you said that there are dentists that don't accept your insurance?
Yeah, it's supposed to be a good insurance. They keep saying they don't take new patients.
Oh, new patients. Oh.
That's one thing. They can't take new patients. We a year or so ago, we just called, and like every single dentist you called, they're like they cannot take a new patient.
So this sounds like a great avenue for you then.
But we did end up the one time going to a local dentist office, which it's got a big name, but I think they sort of run a scam. First visit free, and after that, it's like they start trying to do this and that, and they want you to pay all this money, and you go like, we don't have it. We'll get a loan, like, and we'll put in your kid's name, which is he don't even have a job, and it's just it's tough. Even when you got insurance, you still can't get into them.
Well, it sounds like this might be a good alternative for you then, right?
I would think so. It sounds pretty good, especially for my oldest son that don't have any insurance at all right now. Turn the age, where you have to take them off for corporate insurance.
And we recently hired Dr. Nordland. She had her own practice in Jamestown years ago, and we just hired another dentist in the area so that you aren't waiting months and months, because that's what, I mean, even just moving to this area.
Okay, so that answered the dentist question. What was your second question again?
I think it was on like the Obama insurance, or they said they could get insurance for you.
Uh-huh.
And how does that work? Is it mostly just like a social services insurance, or do they have other ways?
No, we help people apply on the marketplace, and the marketplace, it all depends on your income. So it could be your family qualifies for Medicaid, or your family doesn't qualify for Medicaid, but your children would qualify for Child Health Plus. So if you have children under the age of 18 in the household, then they could be eligible for Child Health Plus, which could be free or a nominal fee starting at $9 a month, depending on your income. And then we can also assist you with private insurance, commercial insurance on the marketplace, anywhere from independent health to Blue Cross and Blue Shield. So there are these different categories that you would fall under. So it would depend on your household situation. You could have a low deductible or you could have a high deductible. So, that is the same kind of insurance that we were referring to earlier.
Okay. Thank you very much.
All right, thanks
You're
for calling.
welcome.
Call back anytime.
Okay, thank you.
Okay. All right, so that was some pretty interesting questions there. What were we talking about? Recruiting and so forth. So, who are you looking for right now then? What kind of positions?
So we are hiring, we're hiring crazy. We're hiring MDs, nurse practitioners, full-time psychiatric nurse practitioners, psychiatrists, social workers. In Dunkirk, we're looking to fill 3 social worker positions right now. And patient specialist positions.
What's a patient specialist?
So that's more so the front desk.
Oh.
Medical records.
Yeah.
We're looking for medical scribes that help assist with physicians. Nursing supervisor.
And what number, if people are listening right now that are interested, what number would they call? Any one of those numbers we talked about?
So either
before?
or the 363-6050 or 484-4334, they go to one call center. So.
Okay.
Or they can go to our website.
Yes, and they can apply through our website. Under employment
ChautauquaCenter.org or something like
opportunities.
that? I just guessed that.
That was right.
You're an org, so I'm an org. ChautauquaCenter.org. Okay,
It's the Chautauqua. They got to make sure that they boot the Chautauqua Center.
the Chautauqua Center.
Center.org,
Okay,
yes.
there we go. You sent me some pictures, Alicia, I think. So how about we talk a little bit about some of those, and you can comment along as we go. So let's pop some of those up, Jeff, if you would, please.
So being a federally qualified healthcare center, we like to get involved within the community as well. That's why we're here. So this is actually the Battle of the Businesses. We just recently, this past year, we did the Battle of the Businesses through the YMCA. So we have a great culture at the Chautauqua Center, and we're really more of a family. And I know that kind of sounds cliche, but it really is like a family. Our CEO, he doesn't look at you as a number or someone that blends in.
Who is your CEO? You refer to him as the CEO. Who is he?
Michael Pease.
Okay, great. For those that are listening right now, we're looking at some pictures of folks that are in T-shirts that look like you were maybe out for a long walk or something?
Yes, this was one of the battles of the YMCA's Battle of the Businesses. It was a 1 mile walk? Yeah, it was down
years
by
ago,
Lakewood.
when I was at BOCES, we were in Battle of the Businesses, and we did the walks and things like that. So it was lots of fun. And you're right, it does bring everybody together like a team. Okay, let's see a few more. Oh, there's some cuties.
Yes, so this is our Family Fun Day. We have each year in August during National Health Centers Week, and it's one of our largest events. It's actually the largest event that we host. So what we do is we have one in Dunkirk and Jamestown.
And why didn't I know about it so I could announce it?
I know.
You should have. I was promoting like crazy.
All right, so right now we're looking at 3 youngsters with
Yes.
looks like backpacks.
Yep, so we give backpacks away and school supplies. It's a way to get all of our community resources, community organizations together. We have 45 plus vendors that come from the Chautauqua area, Buffalo area, and it's really just a fun day before going back to school. And the kiddos will receive backpacks and school supplies if they're
Nice.
present. So.
Okay, let's keep rolling those pictures. What else we got? Oh,
This is another one of our larger events that we have in October. It's called the Mammogrammies event. So it's to
whoa,
raise-
Mama who?
Mammogrammies.
Mammogrammies.
Yes.
Like an award show?
Yes, we actually had a pink
The
carpet.
Grammys. Okay.
So it's to raise awareness for breast cancer.
Okay, and we do
During
that here
Breast Cancer
too?
Awareness Month.
We talk a lot about that in October, right?
Yes.
Okay.
Yes. And so it's really a way of pampering women, and we give free breast exams, free clinical mammograms. We've partnered with Brooks Memorial Hospital, and this was in Dunkirk location, and I'm thinking that we might do it in Jamestown as well. So
Okay.
down the
And
road.
you know,
Massages.
we talk about this in October a lot, that men should also be aware of breast
Mm-hmm.
cancer and don't be hesitant to have a mammogram and so on. And so I'm so glad you're doing that.
Yeah, and we actually give free massages, pedicures, manicures. It's really a way to pamper our community. So.
Wow.
Yes, yes. Come check it out.
All right, there's some dignitaries there.
So this was when we actually first opened our Dunkirk location back in
There's Ann
2013.
Abdullah. I see Andy Goodell. I'm gonna go over here. Okay, I don't know anybody else.
Jackie's back there from Reed's office. You see
Oh,
Jackie,
yes,
yeah,
yes.
she's back there.
Okay.
Our Chief Medical Officer, Dr. Lee.
So you were opening that center. Okay, very nice. All right. How about a couple more, and then we'll get back to that. Oh,
Oh, that was at our Family Fun Day. That's just one of our, actually Conduit, they're full supporters. They donated 200 backpacks last year. I think
that's no
it's
small
way
matter.
over.
That's a lot.
Yes.
Okay.
yeah.
So you got some pretty good community support. What do we got here?
That's Dr. McMahon. She's our psychiatrist we welcomed this past year.
All right, which one's which?
So Dr. McMahon is on the left,
Okay,
and
with the blonde hair.
Christy is our director, our clinical
services.
supervisor.
How many people work for the Chautauqua Center?
Right now we have over 90. Yeah, we're getting close to 100.
Wow. I'm telling you, this is all new to me. This is amazing. Okay. So as we've talked, we've only got the person that I was talking about through the front door. They fill out the forms. They call. They fill out the forms. They walk through the door. And so, what can they expect to happen as far as the physicals? I mean, what kind of things do you do there? Because some doctors' offices do certain things, and others don't do, like minor surgery and all that sort of thing. So what goes on in the centers there?
We're a patient-centered medical home first as well, so we're PCMH certified. So patients come in and they literally work with a team. So
Right.
they're assigned to a physician or nurse practitioner or physician assistant. They have a nurse, they have a social worker. So it's a team effort. So that's, and they will be aware of that on their first appointment.
So they meet all these folks?
They won't meet them all.
All right.
The social worker is assigned to the team if there's a need. That's the nice thing about our integration is we're all in one building.
So like a
and most of us-
one-stop type thing?
So if there's an issue at the time, the physician or one of our providers is hearing, they will call in a social worker immediately to get that going.
All right, so and if you don't need a social worker,
You
they're
don't need
on
it.
your team.
Nope, there's
you're
on the
not
team,
there.
but right, if you don't need them, you don't
Oh,
need
that's a
'em.
very interesting concept. I've never heard that before. Okay. All right, so, I don't know, let's make something up. I have a broken arm. What do you do? Do you person walks in with a broken arm?
what we'll do is we'll set up a first new patient appointment. It's 45 minutes long, and the physician will see that individual.
Check you out, and then,
And if, say, they express that they've never seen a dentist within the past 10 years, then our dental team will step in, moving towards that integrated approach, and they'll ask questions. They'll then get them set up with an appointment after that.
okay.
But for the broken arm,
That's
then
right.
it would be, obviously they'd be sent for x-rays and the specialists, we have agreements with a lot of specialists in our area as well as Buffalo. So it would be our team working with the specialists to get that person where they need to be to cure that.
So you
broken
refer
arm.
them, and they might just say, stop, you need to go to the hospital. Or, but what, so, So what kinds of things do you do at the center? So I was trying to think of something. So, I mean, is it basically not just physicals, or are you doing procedures?
No procedures. It's a family practice, so it's a doctor. So it's a doctor for when you're sick, for your physicals, and those types of things like that. And then if there are more underlying issues, if you're diabetic, then if they need to refer you out, same thing with cardiology. So it's your typical doctor's office and pretty much what it is. Part of what we do there that we did not mention is we also do family planning. A lot of schools want to talk about family planning, but it is the reality of the world that we live in right now, that we still have a lot of teens that are getting pregnant. So we offer those services in our facilities, birth control, and those types of things. And so,
I'm not afraid to talk about it.
Yeah.
I used to teach sex ed when I was a teacher. So with family planning, is this something that any of the teens can come walking in without permission from their family, or how's that work?
Absolutely, yeah. That's the law. So yes,
Tell me the law.
The law is if we have a child who comes at the age of 12 years old and they want birth control, we don't have to tell mom and dad.
Okay.
So it's
They're changing laws all the time, so I never know.
It's a little scary, but it is
scary.
what it is.
But it's for their own protection too. So all right, and without any judgment or anything like that, it's just just like you would take some medicine, or this is your protection. All right, interesting. All right, let's talk about prescriptions. Does the doctor prescribe?
Yes. So in our facility that we were talking about earlier that we are building in Jamestown, we will have a pharmacy on site. So being a federal health center, so we will have pharmacy for our patients right on site.
But not in Dunkirk?
Not in Dunkirk yet.
Okay.
No. But we could, we're trying to work on how we could work that out with some of our patients in Dunkirk if there's a need.
Okay.
We have a lot of pharmacies in the area, and that's not our goal, is to take away from that either. So.
Okay, to work with the population.
To work with.
Okay, you used the word very early on. One of the three requirements for a federal health center was poverty. Okay. You and I know about that from our other life with another agency. But can you just tell us a little bit how you see poverty in Chautauqua County? I talk about it here, but it's always good to get a different perspective on how you see poverty. Either one of you, okay? The numbers or percentages, or, I think people are blind to this, to tell you the truth.
Yeah, I mean, I never heard of a federally qualified healthcare center before starting with one, and the need is there for sure. It's and it's all over. It's not just within the Chautauqua area. There's a need with low income in Buffalo, in PA, but what I've seen is that the numbers are high. It's definitely a needed area for sure.
Rebecca, do you know how high? I've heard that numbers is 45% poverty rates, things like this. Depends on the actual region.
Right. I think it all depends on the region. And I believe here in Chautauqua, I think it's in the 30% right now.
I'm thinking of schools.
Schools are high.
Yeah, because they have
very high.
With a free and reduced lunch, the
schools
numbers
are
very high.
Yes, very high in the schools. I mean, we, for us, poverty, as we're dealing with patients that are coming in and families who are not bringing their kids for their immunizations, that right there is a big sign. They're not following through with their plans with their physicians. I'm sorry, but if I have to figure out how to get food on my table before I'm going to go see my doctor, it's the reality of where we live right now.
Hey, we're down to about a minute and a half, so I have one question, and then I'm going to let you guys release you to do whatever you want to say. Let's say I come in from Pennsylvania. Northeast Pennsylvania isn't that far away. Could you come to the federal service? Because it's federal.
Yes.
Okay. So
we have people from Pennsylvania.
We'll start with Alicia. 30 seconds. What would you like people to know about the Chautauqua Center?
The Chautauqua Center we focus on the individual holistically. We really have a great crew, a great staff that really focus on the quality of care for patients. We don't look at anyone as just a number. And I think that you would find that at the Chautauqua Center. It's a great place to come. We're hiring like crazy. We're doing many exciting things within the community. We're here for the community. You won't feel alone, for sure.
Rebecca, you get last word.
I get last word. Wow. What do I want to say that she hasn't already said and that we haven't already mentioned here? We just we are so happy that you brought us here today
Mm-hmm.
to talk about the Chautauqua Health Center, because there still are many people in our community who don't know about it, and we welcome anybody through our doors.
Okay,
Thank
terrific.
you again.
All right, folks, you heard it here. Now I know all about the Chautauqua Center, and we're gonna delve in this more as the years go by. So stay tuned next Saturday morning right here at Access 5 at 9 o'clock, and we're gonna do it all again. Mark Wilson will be my guest, and I want to thank Rebecca and Alicia for being my guest today. So keep the good work up, and let me know what's going on at the Chautauqua Center. Okay, you take care. Enjoy the sunshine. See you next week. Bye now.